agents, and they are closely related compounds which are characterized by macrocyclic ring. Just like you have seen in penicillin that they have a beta-lactam ring, and in aminoglycoside there's a hexose, tetracyclines there's a hexose ring. Similarly, in macrolides there is a macrocyclic ring. That is, if you see the structure, compare the chemical structure of these agents, you would know the difference between, while you are comparing the chemical structure, that the one with the beta-lactam ring and the macrolides, they have a macrocyclic ring, which usually contains 16 or 14 atoms, which are joined together by deoxy sugars. So in this group, in macrolides, we have, they change the slide now. Okay. So, okay. So in macrolides, we have drugs which are commonly known as erythromycin, azithromycin, clarithromycin, fluxidomycin, and telithromycin. So these are the agents which are grouped together which have the common properties. They are grouped and they're together known as macrolides. Okay. So just hold on. It's really getting proper. If you don't hear me properly, you want me to repeat, kindly let me know. Okay, so the macrolides, these are the erythromycin is the prototype drug, which is the main drug, which has all the characteristics of the macrolide. And the other drugs, they are the modifications of the erythromycin, so making it semi-synthetic, and like clarithromycin and azithromycin and other drugs, so to decrease their side effects and having better efficacy and lesser side effect. So let's see what is the mode of action on antimicrobial activity. Now the drugs, the antimicrobial agents can be bacteriostatic, as you all know, or bactericidal. The bacteriostatic usually means that they inhibit the growth of the bacteria, and bactericidal means kill the bacteria at the therapeutic dosage. So macrolides, they are bacteriostatic, that is when they are given or administered in therapeutic doses, it causes the inhibition of the bacterial growth, arrest the growth, and hence bring about the eradication of the infection. Now, but if they are given in high concentration, they can prove to be bactericidal. Now, these agents, they bind to the protein of the bacteria. They cause, by a different sequence of actions, they inhibit the protein synthesis, and they inhibit the addition of the further amino acids in the bacterial peptide chain, and thereby bring about the arrest of the growth, or in high concentration, they even kill the bacteria. And they are best active when they are at alkaline pH. As you all know that the drugs, they are either basic or they are acidic. So macrolides, they are basic agents, weak bases, so they work well when the medium is alkaline. So, and they bind, if you remember, the tetracyclines, they inhibit the protein synthesis of the bacteria by binding to the 30S ribosomal subunit, which act as the target or the receptor for the drug. Similarly, in case of macrolides, the target or receptor protein is at the ribosomal, which are the protein center of the bacteria. They bind to the 50S ribosomal subunit. So there are different subunits in the ribosomal RNA, and the macrolides, they have the target for the macrolide is 50S ribosomal subunit. Now let's see the spectra. The spectra of the agent. So how how they act, or just hold on. Spectra means the activity of the agents. Okay, how they bring about what is the spectra? Which bacteria they are which bacteria are sent to these agents? Okay, so the antimicrobial activity, you can see that some drugs, they are active against gram-positive, some are against gram-negative. For example, the penicillins, they are highly active against gram-positive. Aminoglycosides, if you remember, they were exclusively active against gram-negative. Yes. Just hold on. Okay, if you have any query besides, अब ये तो अब slide का बनी हुई इस तरह है, I can't change the color of the slide at the moment. You have to use some means because even I'm having problem. अब ये पे सही नजर नहीं आ रही, कुछ white है. अब इस वक्त I cannot change it. I'm sorry. आप इसको थोड़ा सा note down कर लें. Okay? Can you do that? I'll go slow, just note down. So I'm just telling you the antimicrobial activity or the spectrum of activity, the erythromycin. So they're active against mainly against the gram-positive organisms, especially the streptococcus, staphylococcus, pneumococcus, and coronae bacteria, in a concentration as small as 0.02 micrograms per ml. If you increase the at this concentration, the erythromycin, they are bacteriostatic. But if you increase the concentration with susceptible organism, it would be bactericidal. Now let's see the other slide. So resistance. We will do, I will just explain to you the spectra in detail in the next slides. So the resistance. We have already talked about the resistance at many instances. Resistance, I will go and repeat once again. That resistance means that when the administration of the drug, it proves to be of no use to the patient, or the patient complains that he is not responding and the symptoms are there even after 24 hours. So you suspect that there is some resistance that has been developed that is not allowing the drug to act and to eradicate the infection. The best way, as I told you, that once a patient comes to you and you make a tentative diagnosis, you start with some antibiotic or a combination of antibiotic. But the patient complains that after 2 or 3 days, he's not seems to be responding. So the best way before starting the treatment is to give the blood for culture and sensitivity. So that shows you and will give you a list of drugs. अब आपने penicillin दे दिया, tetracycline, macrolide, erythromycin. That report would show you the S or R, the sensitivity or the resistance. So what is the resistance? How the resistance develops? So this is one thing when you are you would become doctors inshallah and you would know what to do. So CS is the first test you are going to give for a patient in which you suspect some bacterial infection. And if the person shows resistance, this is why I'm trying to explain to you that why the resistance develops. So we are not going into the details that when you would become doctors and what you would do, but this is the basis of the resistance, that either the photon channels, anything that is going to reduce the permeability of the drug to enter into the cell. For example, as I told you, there's a difference in the doors. The door of the lecture hall, if it changes and the changes front to back, then the attendance of the students inside the lecture hall would definitely decrease. Similarly, the porin channels, if there's some mutation or change in the porin channel, the drug would not be able to enter at a concentration that is required to eradicate the infection. So this, the first point that you see on the screen, the reduced permeability of the cell membrane or active efflux. So one thing that decreases the concentration of the antibiotic inside the cell is because of the changes in the mutation, that the drug cannot be transported comfortably, easily, conveniently inside the cell, or there is some efflux pump. Efflux pump is a pump which is developed or present in the bacteria. So the amount of the drug which is entering is okay or maybe less. And on top of that, there is an efflux pump that is present inside the cell of the bacteria and it effectively extrudes or expels the drug out of the cell. So the resultant effect would be a decrease in concentration and hence there would be resistance or a decrease in the eradication of the infection. Secondly, is the production of enzymes. If you remember in penicillin, the main reason for the resistance to penicillin was the production of the beta lactamases produced by the bacteria. Here it is on number 2. So these mechanisms of resistance, they are remain the same, but for the particular mechanism may change for a specific agent. For example, here it is the reduced permeability, either because of the changes in the porous channel because of the efflux pump. Secondly, there could be production of the enzyme by the bacteria that hydrolyzes and destructs the drug, making it inactive. Then the binding site, everything is okay, the proton channels are okay, there is no efflux pump, and the drug effectively enters by passive and active transport inside the cell. Its concentration increases, but there is some changes or mutation or modification at the receptor site, the 50S ribosomal subunit, which has to be recognized by the drug to bind and produce its effect. So if there is some modification in the ribosomal binding site in gram-positive organism, which is common. Now, remember one thing, the efflux pump is common in gram-negative pathogens, and the modification at the ribosomal binding site is common with the gram-positive organisms. I'm really sorry about this stupid uh, color. Let me see if I can change color. Can you guys wait for a second? I'm just trying to. Okay. Can you see the slide now? Is it better? I hope. Can you see the slide? Better हुआ? Okay. Thank you. Okay. So, uh, all right. Okay, fine. Let's see the pharmacokinetics. So macrolides, the drugs can be either weak bases or weak acids. So those which are weak bases, they would act more effectively and be more efficient when they are in their conducive environment. For example, macrolides, they are basic agents, so they work well when the medium is alkaline. But if they are destroyed, erythromycin is given orally, which is commonly done, it would be destroyed by the acid which is present in the stomach. So the erythromycin tablet, if you see, it has an enteric coating. Enteric means it is only that coating is meant for the intestine. So that coating जिसको आप कहते हैं ना sugar coating या pink से आपने देखा होगा कई गोलियों पे coating होती है. That coating only dissolves. It is resistant to be destroyed by the acid in the stomach and only goes off or comes out when the medicine enters into the intestine. So such agents, they are effective in intestine. So erythromycin is destroyed by acid in stomach, so it must be administered with enteric coating. The enteric means for the enteric system, for the intestine. So that coating only comes off when it reaches the intestine. Okay. So please save your questions for the end query session. I will give you 10 minutes to ask the question regarding any slide. Okay, now erythromycin is available in two or three forms: erythromycin estolate, succinate, and stearate. Estolate is the most well absorbed, but it is the one form, erythromycin estolate, that causes the most symptoms. So it is usually administered in the patient in the stearic or the succinate form. Because you see, we need to see the patient's compliance as well. अब आपके पास एक patient आया, he tells you the symptoms, and you evaluate the patient, examine them, and according to the symptoms, you prescribe a very good medicine. But you did not, you're not maybe compassionate enough, or your communication wasn't good, and you didn't ask the patient to come for the follow up, and this causes symptoms like nausea, vomiting, or diarrhea. What would happen? The patient would stop taking the drug, and your aim would go down the drain. You want the patient to become well. For all times, you want the quality of the patient uh, to improve. So this has to be taken into consideration. That's why erythromycin acetate, as you can see, it is the most well absorbed. You want a drug to be well absorbed to produce its action. But if it's producing side effects, the patient would not take it. So it means that you have to give another form, which is the stearic or the succinate form. Now, the main organ of excretion is the bile through the biliary excretion, and in the feces, and small amount of the erythromycin, once it's being absorbed and it produces its action, large amount they are being excreted through the GIT and in the feces, and very little in the urine. It means that in renal insufficiency, they can be given. Now, the absorbed drug is widely distributed in all the fluid except for the in the plasma, except for central nervous system, CSF, and in the brain. Now, you see the drugs. This is a very important point because The drugs, when it does not, we don't want the drug to enter into the central nervous system, because all the vital and the important areas, they are in the central nervous system. And if all the drugs they enter and they reaches high concentration, they would produce usually inhibitory effects, which are the sedative effects in the brain, which we really don't want unless and until required. So by highlighting this point that the drug is widely distributed except for CSF and brain. This is the good thing, because we don't want the drug to go either into the brain, or if the mother is present, it should enter to the placenta. But if you can see the last point, the drug when given to a pregnant female in of course in certain situation, when it's inevitable, it enters the placenta. The placenta में अगर enter हो गया, तो it's going to affect the baby as well. So please keep in mind. To change the color of the previous slide so that it becomes uh, more clear to you. Mode of action and right. So let's see once again. I'll go back to the spectra that मैंने आपको बताया कि the basically the drug they are act on the gram positive. The entire, if you see the slide, second or third slide, the entire microbial activity or the spectra that which organism it is most sensitive to the erythromycin. So they are active against gram positive. It's a common streptococcus, staphylococcus, pneumococcus in a very small concentration of 0.02 micrograms. And Neisseria species, gram negative, it is also active against, sorry, gram negative organism, for example, Neisseria species. Neisseria में दो आ गए, Neisseria meningitis, which is responsible for causing meningitis, and sexually transmitted diseases, that is Neisseria gonorrhea. So Neisseria species, it's active against Neisseria species, then Bordetella pertussis, which is responsible for Kali Khasi. Pertussis is Kali Khasi. So Bordetella pertussis is the organism which is responsible for producing pertussis or Kali Khasi. So it is active against Bordetella pertussis, then B. quinata. B. quinata, it is the causative organism for cat scratch disease. So B. quinata Bartonella. Please correct the spelling. It is not Berlonetta, it is Bartonella. Barto Bartonella. Nella. Bartonella. मैं यहाँ पर सही करती हूँ. Okay, I have corrected. You can see the corrected spelling here now. Bartonella henselae, which is also a causative organism for a disease which is called bacillary angiomatosis. So please only remember the names like Bordetella pertussis, cat scratch etiological agent for cat scratch disease, then etiological agent for bacillary angiomatosis, and many sexually transmitted diseases which are caused by Rickettsia and Chlamydia species. Treponema pallidum, you all know that it is a causative organism for syphilis. Now we have uh, two, two or three sexually transmitted diseases caused by rickettsia, by chlamydia, by Neisseria, by Treponema pallidum, and cat spread disease. Then Haemophilus influenza is less susceptible. When erythromycin is given, it is not very much effective against Haemophilus influenza. So, but it does have, if it is given in high concentration, it does have effect, but there are better drugs available to act on the Haemophilus influenza. So this was the spectrum of activity of okay. So move on to the next slide. As I told you, the resistance, the pharmacokinetics. Let's move on to the other slide. I'll change the color. Clinical uses. So let's see the clinical uses. Clinical, there is a difference when it is asked what are the clinical uses. It means that you need to think about, in case of the antimicrobial agents, you have to know the pathogens, and the diseases that are caused by these pathogens. So this is the clinical uses. The spectrum means the pathogens specifically. So as I told you, the different clinical uses here, and you know the pathogen that is affects, so streptococcus, staphylococcus, pneumonia. So erythromycin is a drug of choice in diphtheria, chronic bacterial infection, diphtheria, cat scratch disease, sepsis, chlamydial infection, rickettsial infection, encephalitis, and gonorrhea. So you see, the pathogens, you need to know the pathogens, which was in the previous slide, and clinical uses means you have to remember the diseases. So Bordetella pertussis is for pertussis. Then you can take the name of pertussis. Then diphtheria is another disease. Then coronary bacterial sepsis. Sepsis that is caused specifically by coronary bacterial agents, then chlamydia that causes sexually transmitted diseases. Now, this is important community acquired pneumonia. Community acquired pneumonia, CAP, is different from HAP. HAP is hospital acquired pneumonia. The community acquired pneumonia means the pneumonia that normally the people who get pneumonia from the surrounding, which is not in the healthcare areas. जो pneumonia healthcare area से hospital acquired area से आता है, that is more resistant to be treated because it's already resistant and it is exposed to different type of antibiotics. The common pneumonia that you see commonly in patients is the CAP or the community acquired pneumonia. So erythromycin is very well act on this type of infection, that is the CAP or the community acquired pneumonia, which is the high rate of mortality, the progress of the disease and morbidity and death of the patient. So erythromycin has a spectrum, also has a spectrum of activity against pneumococcus, mycoplasma, and legionella. All these causative organisms, they cause community acquired pneumonia, and these are the causative organisms which causes CAP. CAP, अगर कोई आपसे उसको पूछता है short form में, तो CAP is the community acquired pneumonia, and HAP. HAP is hospital acquired pneumonia. Erythromycin is effective against all the community acquired pneumonia, which is caused by Legionella, Mycoplasma, and Pneumococcus. Sometimes it can be given in people who have allergies to penicillin. So you can use as a substitute in infections that are usually treated by penicillin. तो आप उसमें erythromycin को substitute कर सकते हैं. But this, remember that erythromycin can be given in mild to moderate type of infection, and erythromycin cannot be used as a first line drug in infection like pharyngitis, which are usually caused by exclusively by streptococcus, skin and soft tissue infections, and which are usually in which penicillins they are given for eradication of infection. तो हम first line drug कभी भी नहीं दे सकते if penicillin is available and person is not allergic to penicillin. So in pharyngitis, soft tissue infections, in boils, skin infections, in otitis externa, that is ear infection, you would always give penicillin. If the person is allergic to penicillin, only then it can be used as a substitute to penicillin. Okay, so let's see. Now, there's another, as BDS students, you should remember, erythromycin is recommended as prophylaxis. Prophylaxis means पहले ही आप जब कोई extraction हो रही हो tooth की या कोई भी deep procedures है, dental procedures, it should be given as a protection, especially people who have history of some heart problem, because whatever the dental procedures is carried out in patients who already have a history of heart or elderly patients, erythromycin should be given as precaution or as prophylaxis because of the to prevent the or protect against endocarditis, means the bacteria which are streptococcus and staphylococcus which are present in the mouth, they have high attraction or affinity for the heart valve. So to protect against this, you should give prophylaxis to all patients. It's better to give to all patients. ये आपका वाइवा में बीसीक्यू में पूछा जाता है कि which antibiotic should be given in dental procedure to protect against endocarditis and vice versa. So erythromycin is the drug of choice, and now although clindamycin is also given because it is well tolerated and it has lesser side effects. Okay, the next slide is the adverse reaction. अब आपको सबको इतना तो पता चल गया होगा कि the side effects of the antibiotics, the most common side effects is because of the disturbance of the normal flora on the antibiotics, which are the protective pathogens which are present in the mouth and in the GIT. So okay, so because of the disturbance, ये सबके लिए आप common याद रख लें कि whenever the antibiotics, एक तो common nausea, vomiting, diarrhea, and abdominal disturbance, abdominal pain, loss of appetite, anorexia. You can memorize these for all antibiotics. बाकी जो specific है, okay, sure, okay. So, if some teacher asks you the adverse reactions, so start with the nausea, vomiting, and diarrhea and gastrointestinal disturbances. And the reason for all the disturbance, please remember that all the antibiotics, they interfere with the normal flora, that is normal pathogens which are protective for the mouth and for the GIT. And because they interfere and they're eradicating infection, they eradicate these pathogens that result in the nausea, vomiting, diarrhea, and the loss of appetite. So this is a common side effect that you should remember for all the antibiotics. Now, erythromycin estolate. As I told you, that erythromycin estolate, there are three forms of erythromycin which can be used and administered to the patient. There is erythromycin estolate, erythromycin succinate, and stearate. Among these, erythromycin estolate is the one that is most well absorbed, it is widely distributed, and therefore it can produce better efficacy. But it causes the most GIT disturbances. That's why the compliance of the patient decreases, and the patient does not want to take it because of the diarrhea and vomiting. So the other salts like stearate or succinate salts of erythromycin, they are used. So the first one, the gastrointestinal effects, I told you it can cause, besides from nausea, vomiting, diarrhea, it can cause anorexia and abdominal pain that can range from mild to severe abdominal pain. Liver toxicity can occur in the form of hepatitis, in the changes in the liver function test, and that can of course lead to jaundice. So jaundice could be a symptom and occur, and if you see and make the patient go for the liver function test, it will show disturbance in the liver function test. Then drug interaction, there are certain drugs like propranolol, they are antidepressant agents that may cause the inhibition of the metabolism and may cause inhibition of the आप ये list check कर लीजिएगा कि drug interaction में ये किसको inhibit कर रहा है या किसको enhance कर रहा है. So बल्कि आप ये take it as an assignment के adverse reactions को, because I have just enumerated the name and explanation is not there. So I would like you to enumerate or write few lines about each adverse reaction like gastrointestinal effect, ये मैंने आपको बताया, liver toxicity, drug interaction में when a drug is interacting with other drugs. For example, a patient for whom you have prescribed erythromycin, he might be taking other drugs like antihypertensive or for antidepressant. So there could be an interaction with any anti-anginal drug or drugs which he's taking for any heart problem, for congestive cardiac failure, for diabetes. So the interaction could be enhancement of the action of that drug or could be inhibition of the metabolism. So the resultant effect of both would be different. If it is inhibiting the metabolism of that particular, I'm talking about erythromycin. If erythromycin is inhibiting the effect of the drug that, like for propranolol, so that would cause the increase in the level of the propranolol that the patient is taken. So you have to tell the patient to decrease the dose of the propranolol. Otherwise, there would be toxicity. And if it is causing an increase in the metabolism of that particular drug, when the patient is might be taking, so it would cause the drug to be ineffective. So these are the drug interactions that you have already done in the general pharma. Now the other agents like clarithromycin and azithromycin, flexidomycin, and telithromycin. These drugs, they are similar to erythromycin except that they have been modified in a way so that they become semi-synthetic and they have lesser adverse effect as compared to the erythromycin. So of being manipulated in the lab, the cost is increased and you have to tell the patient. So this is your duty to tell the patient that these drugs, they are going to cause gastrointestinal disturbance because you don't want the patient to stop taking the drugs. So you can prescribe clarithromycin or fluxedomycin or zithromycin. But of course, for example, if erythromycin is for 10 rupees, they might be of 100 rupees. So this, you have to tell the patient about the side effect, and if he's willing to take the more expensive drug, of course, with lesser side effects. So anything that has lesser side effect as a newer drug or semi-synthetic that is being worked upon in the laboratory. So that finishes off this lecture, and the next lecture would be on antiviral. I think that is comprises of two lectures. So any question you want to ask regarding this lecture? This wasn't very difficult. Aminoglycoside and to everyone. Any questions? ये मैंने सबके लिए लिखा. Hello. Hello. Any questions? Okay, feel free and please. I want the adverse effects. Please elaborate the adverse effects and write few lines about each adverse effect of the antimicrobial agents. I don't know how you people are submitting the assignment, but you know that in the present circumstances, it would be given for the attendance as well as for the assignments. Okay, so we'll meet again, I think tomorrow or maybe, yes, sure. I will repeat slide number 5. Let's see. It's slide pharmacokinetics. Okay. So I'm repeating slide number 5. So pharmacokinetics means the properties of the agent. Now, you all know that all the drugs, it goes for all the drugs, they are either weak bases or weak acids. So if it works best in acidic medium and a basic drug work best when the pH is a bit higher. Yes, sure. पहले मैं जरा slide 5, then I will tell you. Student is asking, Mushtaba is asking that to tell the chapters or the topics which are involved in the first examination. I'll come to it in a moment. Let me explain first the pharmacokinetics. Somebody asked about this slide 5. They can the drug, those which are basic drugs, they would be destroyed if they are given orally. They would be destroyed by the acid which is present in the stomach. So some drugs they cannot be given or cannot be covered in an enteric coating. But this erythromycin, as it is basic in nature, it needs alkaline medium to work best or produce its efficacy. The erythromycin comes or formulated in such a way that it has a coating which is called the enteric coating, and this coating it makes it resistant to be destroyed by the acid in the stomach, and it only comes off when the drug goes in the intestine where it is meant to act. And food should not be given. एक तो ये common thinking है layman की कि जी खाने के साथ दो, गर्म होती है, ठंडी होती है, ऐसा कुछ नहीं. Unless until specified, all the antibiotics they should be taken an empty stomach. देखिए food, it is written clearly that food, the दूध खास dairy products, tetracycline के साथ specially स्पेसिफाई किया था कि it should not be taken with the dairy products. और हमारे यहाँ ये मसला है कि जी गर्म दूध से खाओ और जूस खाओ, खाना खाओ, फिर खाओ. If the food is taken, food always interferes with the absorption. It decreases the onset of action. Now, as I already mentioned that among all the erythromycin salts, stearate, succinate, and acetylate is the best absorbed in all the compartments when it is given orally, but it is usually not prescribed by the doctors because it is not well tolerated. It causes most GIT disturbances. So, acetylate or succinate, they are given. The main mode of excretion of erythromycin is through feces and in the bile, and very little in the urine. This gives you an indication that in people who have renal insufficiency or renal problem, erythromycin can easily be administered. The second last point that the drug, they when given orally, it is widely distributed in all the compartments in all the body fluid except for CSF and brain. This usually is taken as a good uh, effect, because those drugs that do not enter the brain, they are not inhibiting the brain. All the drugs that they enter into the brain, they usually have an inhibitory effect. So we don't want any inhibition of the brain. So this, it does not in normal circumstances. Erythromycin is exclusively excluded out of the central nervous system and brain. But if it is or administered in pregnant females, it would enter the placenta. In the placenta, अरे बातें baby को जाएगा, baby को erythromycin अगर दे रहे हैं, चला गया, तो that is the first thing that is going to do, that will be the gastrointestinal upset. You can elaborate it, seeing from the book. So these are some pharmacokinetic properties, and I would like you to make an assignment on the adverse effect. And I would ask Shabazz or whoever that how you are going to submit the assignment. So I have already, I think I previously also gave you a few assignments. So I need you to keep a list of those assignments, because we are going to evaluate on the basis of these assignments. So any other question? Somebody left the class without any information. There are 32 two of the people they left. Okay. हाँ, मैं अब आपको लिस्ट बता दूं कि you have done those in the first module examination. We would have general pharmacology, and kindly the general pharma, there would be more questions from general pharma, and as that is the basis for your whole pharmacology. Then cardiovascular system, all the topics that you have covered in cardiovascular, then autonomic nervous system, plus we would be able to finish. You would have your modular exam in May, I think. So by the end of the April, we would finish the antimicrobials. So that would include. So it means that antimicrobials would also be included. So these are the, if there is any other topic, but these are by uh, now general pharmacology, autonomic nervous system, cardiovascular system, and antimicrobials. All the antimicrobials. And kindly, please don't. Antimicrobial is the heart of pharmacology, because you see, without the drugs, you are not able to treat any infection. And the most common cases that you get in hospitals and in the clinics are the infections. So there is no way that you can imagine that you can leave the antimicrobial section. So this, whatever is included in the first module is of high importance, including the general pharma, the antimicrobial, and in the antimicrobial, antiviral, all the drugs that are used for different infections, plus fungal and the drugs that are used for malaria. Because you see, the malaria and all these things, just think community you are living in. So up to virus to आपको पता ही चल गया how important it is. So viral infection and the difference between the viruses and the bacteria, now I think it is vividly clear to you that what a vast difference it is between the virus and the bacterial infection. I think people who are having bacterial infection, I would think that it's a blessing to have bacterial infection rather than to have uh, viral infection. Allah maaf kare. So please be safe and keep praying. And I'll see you for our next lecture, maybe tomorrow or day after tomorrow for the antiviral. And they would, I think there are two lectures for that. So if you don't have any other questions, I would leave now and see you, inshallah, for the next. And be safe. Inshallah, I'll see you. Allah Hafiz.